Moment of impact, a forceful intrusion. A bullet's journey begins with a deafening roar and a flash of fire. Propelled by explosive force, it exits the barrel at alarming speed. Upon impact, the consequences are immediate and devastating. The kinetic energy creates a shockwave radiating from the entry point. The human body, a complex tapestry, is disrupted. A bullet tears through skin and muscle, sending shockwaves through tissues. Bullet type and velocity determine damage extent. High-velocity bullets inflict more extensive injuries. The entry wound may appear small but hides extensive damage. The bullet's force creates a cavity much larger than itself. The bullet's destructive path tearing through flesh and bone. Once the bullet pierces the skin's protective barrier, its journey through the body becomes a chaotic and unpredictable dance of destruction. The bullet's trajectory, determined by the angle of entry and any intervening structures, dictates which organs and tissues lie in its path. As the bullet traverses the body, it leaves a trail of devastation in its wake. Muscles responsible for movement and strength are torn apart, their fibers shredded by the bullet's passage. Tendons, the cords that connect muscles to bones, are severed, rendering limbs immobile. Bones, the body's internal scaffolding, may shatter upon impact, sending bone fragments ricocheting through surrounding tissues. Organs, the body's vital instruments, are particularly vulnerable to the bullet's destructive power. A bullet piercing the heart can disrupt its ability to pump blood, leading to rapid and catastrophic blood loss. Lung injuries can result in a collapsed lung, impairing the body's ability to absorb oxygen. Damage to the liver, kidneys, or intestines can lead to life-threatening internal bleeding and organ failure. The bullet's path is not always a straight line. It can ricochet off bones, changing direction and creating multiple wounds within the body. These secondary injuries, often overlooked in the initial assessment, can be just as deadly as the primary wound. The body under siege. Immediate responses to gunshot trauma. The human body, despite the sudden and catastrophic nature of a gunshot wound, possesses an astonishing ability to fight for survival. In the immediate aftermath of a gunshot injury, a cascade of physiological responses is triggered, all aimed at limiting damage and preserving life. One of the body's first lines of defense is blood clotting. As blood spills from damaged vessels, platelets, tiny cell fragments in the blood, rush to the injury site. They clump together, forming a plug to stem the flow of blood. Simultaneously, the blood vessels constrict, further slowing blood loss. The nervous system, responsible for communication throughout the body, kicks into high gear. Pain receptors send urgent signals to the brain, alerting it to the injury. The brain in turn releases a surge of adrenaline, a hormone that prepares the body for fight or flight. This adrenaline rush increases heart rate, elevates blood pressure, and diverts blood flow to vital organs. Inflammation, a natural part of the body's healing process, also sets in. The injured area becomes red, swollen, and painful as immune cells flood the site to combat infection and begin the process of repair. Despite these valiant efforts, the body's internal defenses are often overwhelmed by the severity of a gunshot wound. Without prompt and specialized medical intervention, the consequences can be dire. Section 4, Emergency Response, a race against time. Every second counts in the aftermath of a gunshot wound. The rapid response of emergency medical services is crucial for stabilizing the victim and transporting them to a trauma center equipped to handle such complex injuries. Upon arrival at the scene, paramedics work swiftly to assess the victim's condition. They focus on the ABCs of trauma care: airway, breathing, and circulation. Securing a clear airway ensures the victim can breathe. Controlling bleeding, often the most immediate threat to life, is paramount. Paramedics apply pressure to wounds, use tourniquets to stop bleeding from limbs, and administer intravenous fluids to replenish blood volume. Once the victim is stabilized, they are rushed to the hospital, often with a police escort to clear traffic. The ambulance ride becomes a race against time, as every minute lost increases the risk of complications and diminishes the chances of survival. At the hospital, a trauma team consisting of surgeons, nurses, and other specialists is assembled and ready to receive the patient. The trauma bay transforms into a controlled chaos of activity as the team works in unison to assess the extent of the injuries and formulate a plan of action. Section 5. The long road to recovery, healing, and rehabilitation. Surviving a gunshot wound is only the first step in a long and arduous journey toward recovery. The road ahead is often paved with physical pain, emotional distress, and the daunting task of rebuilding a life forever altered. Surgery is frequently required to repair damaged tissues and organs. Surgeons meticulously piece together shattered bones, reconnect severed nerves and tendons, and remove bullet fragments lodged deep within the body. These procedures, while life-saving, mark the beginning of a lengthy and challenging healing process. Physical therapy plays a vital role in restoring mobility and function. Patients, their bodies weakened by injury and often riddled with pain, must relearn basic movements, gradually rebuilding strength and coordination. The road to recovery is often slow and frustrating, demanding unwavering determination and the support of loved ones. The emotional and psychological scars of a gunshot wound can run even deeper than the physical ones. Many survivors struggle with post-traumatic stress disorder, haunted by flashbacks, nightmares, and a pervasive sense of fear. Section 6: Scars that run deep. The enduring impact of gun violence. The impact of gun violence extends far beyond the immediate victims, leaving a ripple effect of pain and trauma throughout families, communities, and society as a whole. Families are torn apart by the loss of loved ones or the challenges of caring for someone with a debilitating injury. The financial burden of gunshot injuries can be staggering. Medical bills, lost wages, and the ongoing costs of rehabilitation can cripple families already struggling to make ends meet. The emotional toll, equally as profound, often goes unmeasured and unaddressed. Gun violence is a complex issue with no easy solutions. However, it is a problem we can no longer afford to ignore. Prevention through responsible gun ownership, mental health support, and addressing the root causes of violence is paramount. We must work together to create safer communities where every individual has the opportunity to live a life free from the fear of gun violence.